Physios.
Oh, good. Hello.
Are you looking after, is this George?
Yes, I am looking after
Hi.
George.
Hi, George.
Hi.
Look, Dr. Best has referred George to me. It sounds like he is day 2 post PEG insertion.
Yeah, he is.
And he's had some respiratory distress, and he's got some changes on his chest X-ray. So I just thought I'd come and do a bit of a respiratory assessment, see how he goes. Does that sound okay?
Yeah, that's awesome. Do you mind though if I just run off for a second? I've got another patient who's just buzzed me. And I'll pop back in a minute if you need me.
No problem.
Okay?
No problem at all.
Cool.
See you in a minute. Yeah, I'd
All
like
right.
to have a chat to you.
Yeah, all right.
Thank you. Hey, George.
Hi.
All right. How are you going today, George?
I'm sore.
You're sore. Oh, I'm sorry to hear that. So, George, you've probably done one of these pain scales before, but if 0 out of 10 was no pain and 10 out of 10 was the worst pain in the world, where would your pain be sitting at now?
Maybe a 7?
Okay, all right. So it's quite, you're in a bit of pain.
Yeah.
Have you tried moving around a little bit, George?
No, it hurts.
Okay, all right. George, have you noticed that it's difficult in terms of your breathing at all?
Yeah, I feel a bit puffed.
Okay, and George, do you usually use any breathing support at home? Do you have any machines that you use, or do you use oxygen at home?
No?
Okay, that's all right. Do you have any family around at the moment, George? Is mum or dad or your guardian here?
Mummy was here before.
Okay, all right. And do you feel like you've got much phlegm in your chest, George?
I tried to cough it before, but I couldn't cough it.
Okay, what do you think's stopping you, George?
It hurts when I cough.
Oh, does it? Okay, and is the phlegm getting stuck?
Yeah, I can't get it out.
Does mum usually help you with your coughing?
Sometimes Mummy pushes on my chest.
Okay, and does mummy usually have to use a suction?
Sometimes.
All right. So usually when you're at home, and do you have a wheelchair, George?
Yeah.
And you're sitting in your chair, do you have much phlegm that comes up each day that you need to cough?
Only a little bit, normally.
Okay, and you've been quite well before this surgery?
Yeah.
Okay, all right. That's all right. Well, I'm the physio, and you've probably met us before, and I'm going to help you today to make your breathing a little bit easier and to help get that phlegm out of your chest, okay?
Okay.
Does that sound all right?
Yeah.
I'm going to have a little chat to your nurse now, just to see how you've been over the last few hours, because they can give me a few more details, but you just relax there, okay?
Okay.
Hey, how you going?
Oh, good.
Sorry, I had to run.
That's okay, no problem. So I was just having a good little chat with George, and it does sound like he's sort of feeling like his phlegm is a bit stuck. Can you just tell me a bit about him for the last few hours? I noticed in the chart that he's gone from low flow 2 litres to high flow 2 litres per kilo at 30%, is that right?
Yeah, that's right. He was desaturating a little bit down to the low 90s, high 80s.
Yeah.
The doctor asked if we could just pop him on high flow, and that's actually helped a little bit. He's been kind of more mid-90s most of the day.
Okay.
He seems to be dropping down a little bit more now, though.
Okay. And have you had to suction him at all?
We've been doing a little bit of suction. I don't feel like I'm getting it, though.
Right. Okay. And has mum been helping with that? Has mum been suctioning, or has she been doing any assisted coughs?
She was doing something a little bit earlier. She had her hands on his chest or something like that. I'm not sure if...
Okay.
I don't know. I think it was a physio thing, but I didn't see it.
Okay, that's fine. Now, he sounds like he's in a little bit of pain. He said to me 7 out of 10. What sort of pain relief is he on?
He's on morphine. We can give him a bolus if we need to.
Yeah, that would be great if you could give him one now, because he is going to need to move a little bit.
Yeah, cool.
Yeah, thank you.
It's all right. Here you go, George.
And in terms of feeds, we're obviously not using the new PEG yet.
No.
He's on some nasogastric feeds, but he doesn't look like there's anything connected at the moment. When did he last have a feed?
Would have finished about probably 2 hours ago. The next one's due in another 2 hours.
Okay, that works well. And apart from the pain relief, he's just on some fluid?
Yep.
Yeah, okay. And I think he's got some ondansetron as well.
Yeah, that's he had some of that earlier, but we haven't really had issues with it.
Okay, and some Panadol I noticed too.
Yeah.
Now, have you moved him much?
I haven't since I've come on. He seems like he's pretty comfortable there to me, apart from being in pain. I'm worried about moving him because it hurts.
Okay, alright. Well, hopefully that should help, having a little bolus. Look, I'm going to do a bit of a respiratory assessment with him, and then I will treat his chest, and hopefully that will reduce the need for his oxygen and will improve his chest x-ray a little bit.
Okay.
It'll probably take around 20 to 30 minutes. Do you think that's okay?
Yeah, that should be fine. I think George is up for it.
Great. Okay. Well, I'm fine to go ahead then, thank you.
Okay, you happy for me to go and look after these other patients?
Yeah, absolutely.
Thank you. I've got tons to do. See you, George. Have fun.
Great. Thank you.